Hi, my name is Philip Yang, a fourth-year medical student at the University of Texas Health San Antonio, and my co-presenter Jake Neal is an undergraduate student at Abilene Christian University. We will be presenting our work titled Using the Constructivism Pedagogy to Empower Youth Stakeholders to Explore Mental Health. While our team at UT Teen Health has received funding for this from the FYSB, this project was not. There's a current national crisis in youth mental health. 1 in 6 young people experience mental health disorder yearly. Women who had a teenage pregnancy are more likely to experience lifetime mental illness such as depression, anxiety, suicidal behavior, substance abuse, bipolar disorder, and psychosis. It's fair to say that we're missing the mark in mental health recognition and treatment for our young people. Our project aims to better understand the changing and growing complexities that influence youth mental health by incorporating youth stakeholders' voice directly in the investigative process. We use the constructivist approach, which was borrowed from the field of education. In this approach, students are empowered as the principal leaders of their learning, while the teachers act as facilitators, supporting the students' active learning process. Similarly, in this project, the academic team facilitated the leadership and curiosity of youth stakeholders in order to develop a comprehensive youth mental health survey. Through the constructivist approach, our goal was to better understand challenges in youth mental health through the unique lens of youth stakeholders. 19 mostly Latinx youth in San Antonio were recruited. In the summer of 2020, the youth met for 8 two-hour meetings, engaged in independent and collaborative research, discussions, and facilitator designed activities. By the end of the survey design process, the team designed a mental health survey with 20 domains and 195 questions. In the 2020 to 2021 school year, the youth co-investigators led the survey approval process at their schools. Of the 10 schools that the youth represented, 5 schools agreed to participate. Importantly, the recruited youth co-investigators were diverse. They were mostly juniors and seniors in high school, females, Latinx, and were in public schools.
This slide goes into further detail about the project recruitment, survey design, and survey administration processes. The youth co-investigators were recruited out of UT Teen Health's Youth Leadership Council, a youth health program. The YLC is made up of over 100 high school students across San Antonio. We initially aimed to recruit only 12 youth, but due to overwhelming interest, 19 out of 25 youth who applied were accepted. The survey design box details the 8 meetings the youth engaged in. The youth learned about scientific research, statistics, and more specifically, research on mental health in youth. The youth then researched 4 national youth surveys, including the National Survey of Children's Health. They then backwards planned the survey, first generating survey objectives and then creating questions. In meetings 3 through 8, the youth revised and refined the survey questions with feedback from the academic team and community advisory board. After the survey was completed, it went through several additional rounds with the IRB until its approval. To get the survey project approved at their schools, the youth designed a plan and met with their schools' administrators and counselors. 5 out of the 10 schools agreed to participate. The youth led the survey marketing, while the academic team received informed consent from participants. Together, they administered the survey virtually at the end of the school year. During the survey, a licensed mental health counselor was available to provide support as needed. Additionally, participants received a $10 gift card. Tables 2 and 3 showcase select mental and sexual health responses in the 120 participants. At least half of the youth reported poor mental health, feeling overwhelmed, depression, anxiety, and suicidal thoughts. And unfortunately, many youth do not know of organizations that support mental health needs. Additionally, 33% of participants have engaged in sexual intercourse, and 51% of them regularly use condoms. While a greater percent of sexually active youth were stressed, depressed, or anxious, there was no statistical difference compared to those who have not had sexual intercourse.
Our work demonstrates a successful collaboration with high school students to investigate challenges in youth mental health using the constructivist pedagogy. The community-based approach incorporated the diversity of our community, which is largely Latinx, and can better speak to the community's unique mental health concerns and needs. Our preliminary results demonstrate that San Antonio youth have high rates of mental health challenges. Interventions are needed to destigmatize mental health from a culturally driven perspective. Teens who engage in sexual activity may be associated with higher rates of stress, depression, and anxiety. However, a larger sample size is needed to determine whether this trend is significant. For our next steps, we will continue to collaborate with academic and community partners to strengthen the rigor of our survey and collect larger and more representative data sets. Please do not hesitate to contact us if you wish to collaborate or learn more. Thank you for your time and for your attention.